Hi, I'm Dr. Rutuja from Parency IVF Hospital. Today we are going to talk about a very interesting topic. The moment patient is pregnant, pregnancy test comes positive, we congratulate the couple and couple says, Doctor, mera normal delivery hoga? ನಂದು ನಾರ್ಮಲ್ ಡೆಲಿವರಿ ಆಗುತ್ತೆ ಡಾಕ್ಟರ್ ಆ ಥರ ಕೇಳ್ತಾರೆ. ಸೊ ವಾಟ್ ವಿಲ್ ಜಸ್ಟಿಫೈ ಆರ್ ಕ್ಯಾನ್ ಪ್ರಾಮಿಸ್ ಯು ದಟ್ ಯು ವಿಲ್ ಹ್ಯಾವ್ ಅ ನಾರ್ಮಲ್ ಡೆಲಿವರಿ? ಇಟ್ ಈಸ್ ಯು ಆ್ಯಂಡ್ ಯೋರ್ ಬೇಬೀಸ್ ಹೆಲ್ತ್. So most important is how is your baby. If your baby's blood flows are very good in your last trimester, that is around 37 to 40 weeks, then yes, you can take a trial of labor or trial of delivering normally. Why trial? Because every normal labor pain does not say that you will deliver normally only. There are 3 stages of labor, and in the 3rd stage of labor, where baby is trying to come out of your vaginal opening, sometimes baby gets stuck because of various reasons, and sometimes your baby's heartbeat starts dropping. Sometimes as a mother you get exhausted. In such situations, unfortunately, even when you have taken the whole pain of labor, still we have to intervene for the welfare and betterment of your child's future and your future. We have to do an emergency C-section. But if your baby's blood flows are already compromised, or your baby is already small for gestation age or growth restricted, in such situation giving a trial of labor sometimes can cause very much, like baby can have permanent brain damage, baby can have a stillbirth, or baby can have certain complications like ventilator and necrotizing enterocolitis later. So in such situations, please follow what your doctor advises, whether to do a elective section at a particular time, which can be even after 28 weeks any day. 28 weeks, if baby's blood flows are not good, it is not going to grow your baby, but there are chances of baby dying in utero. After 28 weeks, doctor can terminate anytime depending on the high risk what it is carrying to get a healthy baby in hand. Apart from that, there is also another reason which has to be taken into consideration for C-section and normal delivery is if your baby priorly diagnosed with any heart deformity, like if there is a hole in heart, or if there is certain complication in the heart, or already there is certain anomaly diagnosed in the child, it is always better to go for an elective C-section and then properly plan your baby's surgery or corrective surgeries, calling all the intensivists, so that you can plan all the procedures with multidisciplinary approach in a better way. Now last but not the least, IVF and delivery. IVF patient comes for IVF in India especially only when all the hopes are gone. That is when finally patient is ready to do IVF. So it is a very precious baby, and in such precious situations it mostly comes with elderly age of the woman. Yes, if you are conceiving at the age of 35 and above, the flexibility of the pelvic bone and the preparation for which is required for a normal delivery can be little difficult or complicated after the age of 35. If you are young and you have done an IVF and it is a precious pregnancy of 10 years married life, we don't want to take risk and wait for a normal labor to start, or we have to give medicines and injections to start a labor and deliver the baby. But yes, if you want to take a trial, talk to your doctor. As I told or mentioned earlier, look for all the signs and symptoms. If you are fit, your baby is fit, all the blood flows are good, you can definitely take a trial of labor. But because it is a precious baby, and when we want something very desperately, lot of complications are always at the bay to come inside. So we as a infertility specialist don't want to take a risk, because we want a healthy mother and healthy baby with a happy ending once you are pregnant. So think wisely, listen to your fertility expert, understand why she is telling you for a C-section or a normal delivery, or even when you take a labor pain, when they advise to emergencyly shift you for LSCS, there has to be some reason. Have faith and trust, because we are sitting here not to just do your C-section or a normal delivery, but to give you a happy ending. Thank you.
If you have any questions, connect with us on the displayed phone numbers or visit our website to learn more.